really good way of developing your healthcare support workers. So I'll let you go, Dawn, and you can get on, and Josie will jump in as needed.
Okay, I'll just share my screen. Sorry, I've just had a cornet up. I was like trying to get it, stuff it in. Let me just share my screen now. Can everyone see that?
Yeah.
Yes, we can. Thanks, Dawn.
Okay, so I can't see anybody. So Moira, if there's anything wrong, will you let me know?
I will do, don't you worry.
Thanks, I'm sure you will. Okay, everyone. So we are here to talk about the Healthcare Support Worker Development Programme. Why did we start this programme? We wanted to support with the winter and COVID pressures. We definitely wanted to raise the profile of the healthcare support worker role in primary care and increase the number of healthcare support workers. We wanted to make sure that our HCAs had a career pathway, and we've worked with different universities to ensure that we have a pathway into either the registered nurse degree apprenticeship or the nurse associate apprenticeship. And we wanted really to encourage career progression into registered nursing one way or another. Who can apply? So if you've got staff where you are, we're looking for anybody who's a new starter to general practice. So if you've got people who've done an apprenticeship in health and social care, they've done the level 2, or they've just joined up and they're not sure what they're doing, and you've got gaps, what you'd like to fill with phlebotomy and healthcare assistant, this is something you could put new starters on. This is for all general practices and practice nurses who are looking to develop reception and admin staff. So I'm sure when you have your dinner or you're out and about and you're chatting with your reception and admin staff, a lot of them will say, I've always wanted to be a nurse, but I didn't get the grades, I haven't got the qualifications, I can't afford to do it. They will all come up with things like that, but this pathway gives people the opportunity to become a registered professional. It's also about upskilling our current healthcare support workers and phlebotomists to be able to do more clinical work to support yourselves in practice. What is the offer that we've got? So the programme that we currently offer is a 6-month foundation development course, and we cover phlebotomy, basic observations, cardiovascular disease, hypertension, some long-term conditions. We also offer the care certificate. The dates for that have just been sent out, and we're running cohorts of 15 online with Hotwood College. And also we offer functional skills. So a lot of people are concerned that they can't progress any further because they've got the maths and they haven't got the maths and the English. But we can support with that and make sure or help people to get their maths and English. We have Elaine Stone, who is our dedicated supervisor and mentor. So she holds regular one-to-ones with all of those on programme. And also, if they're struggling to get signed up in practice and you are struggling due to COVID and workforce issues, Elaine's more than happy to come out and be a mentor for the day. So if you've got somebody who's doing phlebotomy and they've done our phlebotomy training, but you as the general practice nurse or anything else haven't got the time to support them to do that clinic and sign them off, let us know, and Elaine will come out and do that clinic with them.
Dawn, are your slides not moving on? Are you still on the first one?
No, I'm on the second one.
Oh, right. I think we're still on the first one.
Oh, why does this always happen to me?
That's because you've been eating a cornetto and you've got sticky fingers on your keyboard.
I haven't.
She has. Let me tell you, everybody, she always has a drama.
I lost the tortoise this morning.
I told you.
I tell you. Can you see that now, Moira?
Yes, I've got it now.
Latest offers?
What is the offer we've got? What is the offer?
Yeah. Okay, we've also we've worked with Greater Manchester Training Hub, who were offering a package of spirometry and the level 3 apprenticeship. They also offering some IMS and VAX training for those that are eligible to go on it. So then the question is always from practices, what does it cost? And the answer is nothing. absolutely nothing to the practice. It is just ensuring that you give time out of practice and that somebody's available to support, or that you get in touch so Elaine can support them. There is no cost whatsoever for any of this training, which is brilliant, because we didn't think we'd be able to get as many on with the funding that we've got, but because we've been able to negotiate and we've got Elaine, who's our mentor and can offer teaching, we've been able to extend this package, and we've still got places available. So how many do we have on so far? So currently we've got 105 people on this programme, and they're a mixture of different staff backgrounds. So we've got admin and reception staff, we've got current healthcare support workers, we've got phlebotomists, we've got care coordinators, and we've also got a few practice managers who've taken part. So what have they done in the last few months? So we've got 12 who've applied for the level 3 health and social care qualification. We've got a number who've applied for the nurse associate. We've got others who are undertaking functional skills for January 2022 to go on to the nurse associate, and that is just maths and English. And we're working with Manchester Adult Education Centre to get these people on. And again, there is no cost attached at all to people doing their functional skills. It is just a question of allowing them a little bit of time, or ensuring that, you know, they've got support in practice if they're struggling a little bit with things. We've got some that are awaiting confirmation. So a lot who've done their GCSEs a number of years ago, or when Moira did whatever she did back in the dinosaur ages. We're waiting for them to get confirmation of their grades, and we will support with that. We will pay. So for anybody who cannot find their certificates and needs to send off for them, they are £45, and then we're happy to pay for that. If that means that they can progress on to something else, we will pay. And we've got the registered nurse degree apprenticeship that 3 have applied for. So those that are going for the registered nurse degree apprenticeship will have already done a level 3 and have those functional skills to be able to apply for that. What are we doing next? So Elaine is our HCA mentor who's in place. She's been offering individual sessions regarding the level 3 apprenticeship, the trainee nurse associate, and the registered nurse degree pathway. We do a regular HCA forum. So we've been running this HCA forum now for a few months, and this month, so next week, our forum has 2 speakers. One is Michelle, who is a current nurse associate working in primary care, and she's going to talk about how she found sort of progressing from a healthcare support worker into the TNA, and what she does as an NA now, a qualified NA in primary care. I'm discussing with them about the application, that you've still got to do your application and your, what's the thing, Moira, that everybody, personal statement, sorry, and how to go around developing that. And then we've got another one of our one of our healthcare support workers who's applied for the nurse degree apprenticeship, and she started in April, and she's going to talk to the others around her route into the nurse degree apprenticeship and how that's working alongside doing her current job and doing the apprenticeship. So what you need to remember is that these are both apprenticeships. They have to be in employment. There is backfill available, whether they do the nurse associate course or the registered nurse degree apprenticeship, but they do need to be in employment. So that means as they go into an apprenticeship, they will do so many hours per week doing their regular job, and then so many hours a week will be out either on placement or at university. Elaine's also got further teaching sessions planned, and she's doing asthma, diabetes, respiratory and sepsis. We've got phlebotomy that's on today, and that's fully booked. And we're doing phlebotomy. We do the training at different sites across GM, so we are able to book different areas and get people on, so they're not all travelling across Greater Manchester to get to a training course. The feedback from these courses has been phenomenal. a lot of them that have come on have said, I never thought I'd get this opportunity to be able to progress any further. And we think that's why the uptake has been so good, really, to say that we've been in the middle of a pandemic. We launched this in December, and that practices have been so supportive and enabled the staff to have the time off. What are we doing next? So we want to future-proof the healthcare support worker role and to look at how we develop it further across community and secondary care. We are looking to do the GM passport for healthcare support workers and also for our reception and admin staff. And we are looking, I know there is a real issue around recruitment currently, and that a lot of practices aren't able to recruit. They're struggling to retain staff. And that's been really difficult. And we are looking at how we can work together a lot again with Greater Manchester to make sure that we can look at a kickstart offer to put these students, to put people who are unemployed onto this pathway to increase the workforce again. So it's a bit blurry, but you can see the pathway is there. We've got, if you're an admin, reception or HCA, you come onto the foundation course. There's then the nurse associate, or you can do the level 3. You can then go on to the part-time registered nurse degree apprenticeship. And if you've done the TNA course, you can APEL and skip 18 months of the registered nurse degree apprenticeship, which is why we think the level 3 hasn't had as much uptake, because, you know, if you're going to do a level 3 and then go on to do 4 years and 7 months, that's a long time. Whereas you could do the TNA course and then skip out 18 months for nurse degree apprenticeship. And then you can go on to be a general practice nurse. We've got the foundation offer for the GPN foundation and the GPN fellowship offer that are out there as well. If you would like an expression of interest form emailed to you, you can email Sam Austin. Sam will send that expression of interest form to you. And if you want any further information, you can contact either Elaine or myself, or you'd be welcome to come to one of the HCA forums, or arrange, you know, to have a Teams meeting and we can catch up with you on everything that you need to do in order to support. That's the end of my presentation, and it leads nicely into Josie and what is the offer around the trainee nurse associate programme. So I'll introduce Josie.
Dawn, can I just ask a couple of questions before then?
Of course.
As soon as it's me. How can the HCAs attend the forum? Where's this advertised?
It's only been offered so far to the HCAs that are on the programme, but we are going to go out with a GM-wide offer so as that people can come on. So if that's for Hilda, I can make sure that Sam sends you the link out for next week's, and well, I can make sure that the link goes out to everybody on here today, so you can invite your HCAs.
And another question is, how can the HCAs access the training sessions for asthma, etc.?
So again, that will go out GM wide. Elaine's giving us some dates for that, and we will put that offer out right across Greater Manchester. So we'll send it out to everybody who's been on the forum today, so you can pass that on to your HCAs.
Oh, thank you, Dawn. I'll let you introduce Josie now. Sorry about that, Josie.
Okay, thank you. Thanks, Myra. Okay, so I know we're pushed for time, so I'll just give you a quick whistle-stop tour of the trainee nurse and associate programme. So I'm Josie Hines. I'm actually leading on the training nurse and associate project within social care for Greater Manchester. So I'm here representing my colleague Deborah Holden, who leads on primary care. So just a quick run through of the development of the nurse and associate role. It was developed on the back of the Shape of Caring review in 2015. And some of the recommendations out of that review were about employing the right people with the right values and behaviours, bridging the gap between healthcare support workers and training nurses and registered nurses, and being able to widen the access to the nursing profession. So to be able to go through and become a registered nurse via an apprenticeship route while you're still working, so you don't need to go to full-time university. So we've had nursing associates on the register now since 2019, and they work in a variety of settings. It's a generic role within primary care, social care, within hospital settings and within the community. And they are part of the nursing team, and they are a role within their own right. So it's a foundation degree apprenticeship that you would do while you're working. It's a 2-year programme of study. It allows you to earn whilst you learn. You need to be employed in a service with nursing. And as Dawn mentioned with the other training, this is fully funded also. There is no cost to the student or to the employer. So it's funded via the levy, by the apprenticeship levy, and Health Education England also offer additional funding to support with uniforms, any resources, any further development you need for your team. TNAs attend university 1 day a week for their academic study, and then you work 4 days a week clinically under the guidance of a practice supervisor. So that will be a registered nurse or other registered healthcare professional. So 3 of those days will be practicing your skills, and 1 day you'll be building your theory knowledge. And as I said, it's generic. You're going to cover all 4 fields of nursing, and you'll work in 3 different settings: at home, close to home, and within hospitals as well. The entry requirements for the nurse associate are GCSE Maths and English at grade C or grade 4 and above, or functional skills at level 2. So these are your essential entry requirements. You also need to demonstrate an ability to study at diploma level. So it might be that you've done the level 3 apprenticeship. It might be that you've done the Healthcare Support Worker Foundation. You might have significant experience within the practice setting. So universities will accept in-house training as well. You'll have a DBS check. You need to be eligible to work in the UK and have had successful occupational health assessment. And if you're already doing an apprenticeship, you need to have finished that before you transfer onto the TNA apprenticeship. There is also a self-funding route where you would be a full-time student. So this slide is just looking at the differences between a registered nursing associate and a registered nurse. So if you look at the NMC platforms, nursing associates have got 6 and registered nurses have got 7. So as I said, nursing associates are part of the nursing team, but registered nurses are going to be assessing and planning the care and leading and managing the nursing care. Nursing associates will be promoting health and preventing health. You'll be an accountable professional, same as registered nurses, provide and monitor care. You'll both work in teams. You'll improve safety and quality of care and contribute to that integrated care, but you won't lead a nursing team. You could lead a nursing associate team and you can lead healthcare assistant teams, but essentially it will be the registered nurse that will be leading and assessing and planning that care and coordinating. So Dawn's already shown you an apprenticeship pathway. This is pretty much very similar to that. As Dawn said, there's different stages, and depending on where you start on the road, you might be able to jump a stage or start at a different stage to other people. But it just shows you that there is a way to work your way through, however it works for you, to become a registered nurse. And then on here, there should be a number 6, because you can go on then to do advanced nurse practice as well. Within primary care, once you are a registered nursing associate, you can go on to do cytology once you're registered. So that was, as I said, a quick whistle-stop tour through the TNA programme. If you're interested in the TNA programme, you can get an expression of interest form from that email address at the top. The TNAs have also got their own Twitter page and Facebook page, and that's got social care training. So it's social care TNAs and primary care TNAs. So if you want to keep up to date with what they're up to, you can give us a follow. Thank you.
Thanks, Josie. That was really interesting. Is there any questions for Josie about the TNA programme? You don't have to be shy. We're very approachable, promise. No? No?
Is there any TNAs on who want to share their experience?
No. Is there anybody interested in going on the TNA programme and have got any questions? No.
I think everybody's a nurse, aren't they, who was looking to develop their HCAs on their reception and admin staff.
Yeah.
I think, I think that's, I know we rushed through it knowing that we were really short on time. It's normally we run over.
We could do a sing song around the campfire now or something.
Oh no, thanks, Myra. Does anybody want me to put the link on for the expression of interest form? Well, actually, can I do that? Am I clever enough?
Yes, you are.
Let me just say.
I think really we've both given you lots of information there, but I think the message is, you know, the development opportunities are there. I think somebody put in the chat that they were going to spread the word, so that's fantastic. You know, the more people that know about the opportunities, the better, to be able to develop primary care workforce.
Brilliant. Oh, so we have got lots of people who are really interested in the TNA and that's it exactly. You've worked somewhere for 20 years, and I think people have really struggled to progress any further because a lot of people just can't, especially, you know, when you've got kids and a family, the idea of giving up a salary to go to university is quite daunting, whereas this way you can get paid while you go to uni, which is just a brilliant way of being able to do that. Just trying to figure out how I can attach the form. I'm no good with this at all for the expression of interest. But what I'll do is I'll put Sam's email in the chat and Elaine's, and that way you can contact them. So is that you can send for the expression of interest form straight away. And Sam can send you the expression of interest form, which covers the TNA as well. So you can go direct through to Sam and get all that. And if you want to join the forum, you'd like to hear how the NA role supersedes the HCA role in practice, Elaine. So the NA role gives you a pin at the end of your training, which opens your scope of practice more than what a HCA can currently do. So it does cover things such as the cytology, there's different immunisations. I'm not clinical, so Myra might be better at leading on this bit. Myra?
Sorry, I missed the question.
Sorry. How does the NA role differ to the HCA role? So I was saying I'm not clinical, but basically it gives you that registered pin at the end.
Yeah. So you'll be on the NMC register. You'll go, they start usually on a band 4, so it puts you up to a band 4. You'll be able to, in practice, once you've got your pin number, we'll be able to put you on the cytology course, so you can do smears. But also, should you want to do the nurse degree afterwards, then because you've done the NA program, then they count it as 18 months and you go into the second year of your nurse degree. So you kind of miss out quite a bit of it. But you've not to say it's like the old SEN program. When I was nursing with Florence in my heyday, me and Florence Nightingale were really close friends, as Dawn will tell you. We had registered nurses and we had state enrolled nurses, and this compares a little bit to that really. So you'll be able to do certain things like more advanced asthma reviews, diabetes reviews, smears. The only thing you can't really do is childhood IMS at the moment, but you'll be able to work under PGDs rather than PSDs. So I hope that helps a little bit, but it'd be nice just to increase your knowledge and also go up a pay band, which is always nice to have more money in the pot. So does that answer your question, Dawn? Sorry, I was texting somebody. I wasn't listening to you.
It's all right. No, there's a few more questions in the chat around
the difference between assistant practitioner and the NA. So the assistant practitioner was a course prior to the nursing associate course, and the NMC never took it up and allowed them to be registered. So the skills are similar, but the assistant practitioner won't be able to do cytology and certain immunisations because they've not got the PIN number. So that's the only difference really between them. As an assistant practitioner, you can APEL onto the nurse degree course, depending what your modules map out. You have to map them out. So sometimes it's working that the assistant practitioner course does map out, and we can put you on the nurse degree course. We've got 5 on the nurse degree course, the part-time nurse degree course at the moment. Is there any more questions? Sorry.
Yeah, so Elaine's asked about that you'd have to be paid band 4 by the practice. So basically, Elaine, on completion of the NA course, they would have to increase your salary, as you would be. It's expected that you're paid that.
But your role changes, you'll be able to do more.
And it's covered. Currently, it's covered under the R's role funding, isn't it, as well, Moira?
Yeah, so there's money in the additional role reimbursement scheme that each PCN has got. So a lot of the CCGs are taking up the R's role for nurse associates. So keep an eye out